going to wrap your legs here. First, we're going to put on the thinner, there's a thinner and a longer stockinette. We're going to put on the thinner, longer stockinette on first to cover up all of her skin. Make sure we don't have anything that the wrapping is going to go directly on top of. Below the knee. We'll fold that back at the end. Okay.
I'm sorry.
And we want to take the padding roll here, and we're going to put the padding down right at the base of her toes. So there's where her toes stop right there. We're going to come right around the base of the toes, and we're just going to make sure we cover up the entire leg with the padding. In here. Then we've got 2 rolls for each leg. So this is where the actual compression comes from. And you want to try to lay it down and pull it around this way. If you are holding it like this and you have to unroll it and then pull and unroll it and then pull, you can't get as even of pressure. It's not as even and consistent. So you want to lay it down there and cover up the end of the roll. So you want to make sure nothing's sticking out there. And then you're going to do a big overlap and put some tension on it. You're not trying to pull as hard as you can possibly pull, you're just keeping tension on it. So I could pull much harder than that, but I'm just keeping it taut, maybe about 50% of the available tension in the wrap. And you're going to go all the way up the leg. Your first roll should pretty much cover the foot and the ankle, and then the next roll is going to cover up to just below the knee. Once you've gone all the way around there, then you want to tape it off. We don't want to use clips on this because we don't want this clip to run the risk of scratching the skin. Then you'll take your next roll, and these, by the way, they look like ace bandages, but don't try to use an ace bandage on the leg because these are short stretch bandages. I pull it as hard as I can go, that's as far as it's going to stretch. An ace bandage will stretch 4 or 5 times more than that. So you're going to cover up the end of the previous roll, and you're going to come around and then try to get this one to get up to where your padding stopped, just below the knee. And again, you're trying to keep it nice and taut. But not trying to pull as hard as you can. Should feel very snug, maybe uncomfortably tight sometimes, but not painful. If we're getting actual throbbing in the foot or real pain in the foot or in the leg, then we need to loosen up. But if we just have a little bit of coldness in the toes or a little bit of color change, that's no big deal. And we want to try to fold this down so we have a clean edge there that's below the knee, so it's not digging into the back of the knee joint. And then we take our shorter, wider one and cover up the wrapping to help it stay in place here. And there you go.